Hi guys, this is Dr. Bhupesh once again for you all from Dr. BKM OET Institutes, and just trying to summarize a lot about OET and most importantly what we have done this week. Again, if try to summarize what OET is all about, suppose if I tell you all the experience I have gained over the years, then I will say first of all the most important strategy, especially the guys having exam tomorrow, is listening. Please, before going to your exam, listen to something. Please listen to something in English before going to exam. This is known as warm up. Warming up is very important. Just like when you play any sports, warming up is very important. In the same way, when you are going for your OET exam, listening to something, don't execute any question. Listening to something is something that is very, very important. Then read something. And again, strategy in the reading is very, very important. Out of the first 7 questions in the part A, you will get 4 to 5 easy questions in 2 minutes. Please do not waste more than 2 to 3 minutes in the first 7 questions. Do not start from question number 8. Start from question number 1. Whatever you can find A, B, C, D, try to do that quickly. Like if D part is talking about treatment, if by chance any option is talking about medicine, so medicine means treatment, then do it D. Make it simple for yourself. If there is any paragraph that is talking about x-rays, CT scans, and if the question is what form of investigation, obviously that means it is given in that paragraph, then you do C and you just move on. Means try to relate what is an investigation, what is treatment. Paracetamol would be part of treatment, side effects would be part of complications. Please try to relate to these words. When I'm talking about these words, demographics, statistics, numbers, numericals, percentage are the same thing. Statistics means numbers, means percentage. Demographics also is like these kind 20% of people, 20% of rich people. So demographics also mean the same thing. Sometimes we get confused. So when there is any word like statistics, then if there is any paragraph that is talking about the percentage and question is about statistics, that means they are talking about this paragraph. So do A, B, C, D and move on. So when you go to question number 8, again, if there is any question that you are unable to find, you have to go deeper into the paragraph. Please don't do it. You just have to do superficial questions that can be easily done with skimming and scanning. So I've got many reading videos in our YouTube channel. If you're our YouTube channel follower, please go to a reading part A video that will let you know how to do it and which questions are supposed to be left. Otherwise, it's simple. If I'm trying to find a keyword like today we were trying to find a word mesh and weakened reason. So weak area word was given, synthetic mesh word was given. So it was easy for me to find in the paragraph C. So it was easy. If I do not find it, that means it is difficult. So I leave that question. It's very simple. Don't do any difficult question in the first round. Means in the reading part A, try to finish at least 14 to 15 or 16 questions in 10 minutes only. Then have 5 minutes to do the deeper questions. So you save your time when you do easy questions first. Then grammar is very crucial when it comes to writing, speaking, and people think that grammar is not applicable in reading and listening. I'm afraid to say grammar is the first thing I do. If any option in OET reading, if any option is having the words ly like rarely, mostly, often, frequently, hardly, then please read these words very carefully. Most of ly words would be eliminated. But don't eliminate just like that. You have to understand, because if I say that mostly, uh, mostly older men are affected due to this disease, and if in the paragraph it is given that men are affected due to this disease, then obviously older men cannot be my answer. But if in the paragraph it is given older men are affected by this disease, but option is saying that older men are frequently or mostly affected by this thing, even then this answer is wrong, because mostly means most of the times older men are affected. But paragraph is saying just older men are affected by this disease. They are not saying mostly or rarely. So this cannot be my answer. So you have to be careful about these words. Options having may obviously have more chances of being an answer. So please consider option having the words possible, having the words can, could. These options have higher chances of being. Means I want to say if A, B, C, D options are given, if C option is having the word may, this has the highest chance of being an answer. Done. Now, the most important part, apart from noticing these grammar words, modals, can, could, may, might, there is other thing that you can notice is degrees that I always talk about, good, better, best. So always be careful about that. There is a separate lecture about this, but I'm just letting you know what are the things important to be noticed. So go for the words bad, worse, worst. So please read these words carefully. Like in today's reading, we were doing that pain. This was given in the line pain related to inguinal hernia. Then there was some line, and in the answer they wanted the dash. Dash was given, the dash associated with inguinal hernia, pain related to inguinal hernia, worsen. That word was given, that was I was teaching. Worsen means bad, worse. Worse means is getting more bad. Worse is a second degree. Bad, worse, worst. Good, better, best. Late, later, latest. Late is late. Later means more late. Latest means the last. In the same way, worse means that the pain is getting worse. So in the blank, it was given the dash associated with inguinal hernia is exacerbated by. So exacerbated means it's getting worse. So if you will relate these two sentences, obviously now I am teaching you, you can relate it very easily. But you can see preposition changed, related to became associated with. Inguinal hernia were same. Worsen was replaced by exacerbated. So this is a difficult blank that you should do in the second round. But if you can see this word, then it's perfect. Please try to understand. But in the first round, if you are doing question like this, obviously that means you are taking 2 minutes in one question. And in reading, you are in the part A, you have 15 minutes for 20 questions. You have less than 45 minutes for 45 seconds for one question. If you are wasting 1.5 minutes on one question, you won't be able to. So please don't do questions like this in the first round. But in the second round, please try to relate these words. Worsen means exacerbated. It's getting worse. It's getting aggravated. So that is what is the point. So that is the importance of degrees. So yeah, options like may, might, can, could are very important to be noticed, but please try to understand. Don't do it blindly. Then degrees are very important. Then again, the most important thing, that is what I created this lecture for, active and passive. This is like a superb thing. Like yesterday we were doing a listening and there was like price tags, a stimulate me or something like that word was given. Uh, price tags concerns me or something like that was given, concerns me the most, something like that. But in the blank of listening, you can understand how fast the listening is. So it was given the patient. So listening was speaking. Price tags concerns me the most. The patient is concerned with dash. Now it is very hard because they have changed the active into passive. How? Because with word is acting as by over here. So the patient is concerned by the price tags. Means he worries about the price tag of a treatment. Price tag means he worries about the price of a treatment. So when they are speaking, they speak it active. They spoke it actively. Price tag worries me the most. So patient is saying this. And in the blank, it is given the patient is, kind of concerned by or concerned with dash. So price tag. So that is what is the importance of active and passive. You have to be really careful about this. What is active and passive? If I tell you, I am teaching you right now. So passive means you are being taught by me. That is what active passive does. Active means I am teaching you. That means I am the teacher. You are being taught means now object has become subject. I am teaching you. You were object, but now you are the subject. You are being taught by me. By word defines passiveness. But at the same time, be plus third form is the main rule of passive voice. That is why when it comes to applying in the writing, please again listen to this lecture very carefully. I'm trying to cover everything. So it will confuse you if you will not listen it again. If you will listen it again, you will become powerful. Passive means be plus third form. Be plus third form means was were third form or been plus third form. Majorly. Otherwise, it also means is MR third form. Is MR third form also means B plus third form. But when it comes to usage in our life, we don't use it too much. Even in OET, we don't use it too much. But this was an example of is MR third form. Price tag concerns first form. It was changed to is MR third form. Is concerned. So I could get it was a passive voice by my rule of B plus third form. Whenever you see B plus third form, B plus third form means is MR third form, was were third form, and being third form or being third form. If you see anything like any of these words is MR, was were been being with the third form, that means it's a passive voice. 100%. So that is what I can, when I was reading this blank, if I know the grammatical rules, I understand that the patient might speak active. So he will say, price tag concerns me the most. Then I have to understand the word concern. So patient is concerned by price tag. So that is where you have to be really active. You should know active and passive. And now what is the benefit of this rule? When we do visit letter, which is supposed to come or which can come this time, is was the third form. How do we write visit letters? Again, on first visit, the patient was having symptoms. So this is active. The patient complained of active, this and this thing. Rest everything passive. On examination, passive voice. Because he was found by us, was plus third form. He was found with signs. Then you will talk about diagnosis. He was diagnosed with. Always make a passive voice. He was diagnosed with this, for which paracetamol was given. So if you can notice this passive voice, was plus third form, that means all this thing is done by us. Us means hospital, nurses and doctors. He was diagnosed by us. Disease signs were found by us. Patient was found with elevated temperature. Patient was found with increased temperature. So paracetamol was given by us. So all the things are in the passive voice in OET. Its only active voice is when patient complains by himself. So that's the key. Please listen to this recording again and again. It's a very simple recording, trust me guys. But I have spoken little fast. So obviously it's like hardly 5 to 10 minutes recording. So listen to it 3, 4 times. Trust me, it's gonna make you very powerful. Because most of the persons, they pass OET exam in a way. Not if first time, maximum second time, but I'm not saying negatively. I am not here to make you negative. But the people who are majorly getting or losing marks is 10 or 20. So this lecture is something that can improve those 10, 20 marks. I'm not saying this will make you reach from 250 to 350. But if you are stuck at 320, 330, 340, then this video can take you to 350. Because maybe one question can come off may, might, can, could. One question can come of active passive. One question can come of exacerbated by degrees. One question can come of active and passive. So again, this lecture will really be handy and just 5 minutes of your time, but do it like 3, 4, 5 times. The more you will repeat, the better you will get. Like this is degree. The more you will repeat, degree means much, more, most. More is the second degree. The more means the more you will do it, the better you will get. Better means good, better, best. So the better you will become. That is the importance of degrees. The more you will do, the better you will become. So this is Dr. Bhupesh from Dr. BKM OIT Institutes for you all. Please listen to this video again. Also, you will get to know what is active and what is passive. Because obviously, when I teach slow, we discuss more examples. But ultimately, active, passive is only hidden in B plus third form. I am I am doing my work, active. My work is being done by me, passive. He has done his work, active. He has been found with, passive. B plus third form, he has been found with. Now doctor will find him. That means he is patient. He has been found with means patient has been found with. If I say doctor has found, he has found, that means he is a doctor because it's an active. He has found something. So doctor will find something. He has been found means he is patient. That patient has been found by the doctor. So that is what been does. Been, it changes the configuration of a sentence from active to passive. So that's it. Please listen to this lecture for your own good again. I don't know why do I say please. I should order you rather. But yeah, it's up to you guys because it's your life. And this is me for you guys. Thank you very much.